Neurofeedback, of course, is based on classic conditioning, which essentially says you can condition a specific response using repetition and some sort of reward or positive reinforcement, sometimes even negative reinforcement. So with neurofeedback, essentially the patient or the client is learning how to consciously change and regulate their own brain, and then they're receiving positive or negative reinforcement based on what their brain is doing. So if their brain is doing a positive thing, they get that positive reinforcement. So if you do that over and over again, the idea is they can learn to train and regulate their own brain. So with Cereset, we take the conscious brain out of it, because with neurofeedback, that does require the client or the patient to use their own focus, attention, willpower to make these things happen. And especially for people that are struggling with attention and focus issues, anxiety issues. I worked with so many clients that have come to us and said, oh, I did neurofeedback, but I have performance anxiety. So the sessions were really stressful because I'm like, I'm paying a lot of money to be here and I need to get results. And then that would just heighten their anxiety the more the session went on. So with Cereset, it just takes the conscious mind out of it. Like I said, most of our clients just sleep through their session. So they're not consciously trying to regulate or control anything. The brain is actually making all the decisions and deciding what changes to make and when. The other difference with neurofeedback is that essentially they use an ideal brain model to compare the brain against. And that's developed basically by averaging a lot of brain data together, right? And then you come up with this isn't a typical brain or an average brain or an ideal brain.
Yeah.
At Cereset, we strongly believe every brain is unique, which is a fact.
Totally.
No two brains on the planet are the same or similar. You can even have similar diagnosis as someone else or similar symptoms, and your brains will be different. They will not be the same. Most people assume like we'll have the same patterns. Not the case. Every brain expresses itself differently. So we don't believe that we should be making brains all try to look the same. A 40-year-old female artist is not going to thrive with the male of a 20-year-old male athlete, right? They have different needs, goals, strengths, and that should be reflected in how you work with their brain. And so with Cereset, we do not use an ideal or an average brain model, and we're only comparing the brain with itself. So we're not comparing your brain to someone else's. We're comparing your brain with itself. And we talked a little bit about those measurements. We measure the left and the right hemispheres activity. We measure harmony, which is basically brainwave frequency distribution in the brain. And that's how we assess your brain. So we're never comparing it to someone else's.